Flushing and locking your central venous catheter, also called a CVC. In this video you will learn 1. What is flushing and locking your CVC? 2. When to flush and lock your CVC. 3. How to flush and lock your CVC. This video does not cover the flushing and locking of a portacath, which is usually done by a nurse. What is flushing and locking your CVC? Flushing and locking is the process for cleaning your CVC to prevent infections and keep your CVC working well. These are the parts of a CVC. Your CVC may have 2 or 3 tubes that come out of your skin. These tubes are called lumens. In this video, there will be 2 lumens as seen here. You will flush and lock the first lumen before starting on the second lumen. Lumens are used to give IV treatments or take blood. On each lumen, you will find a clamp. The clamp is used to prevent blood from coming out of the CVC. End cap. An end cap is added to each lumen opening. The end cap stops blood from coming out of the lumen, stops germs from entering the CVC, and helps to attach IV tubing and syringes safely. To keep your CVC clean, leftover blood or medicine needs to be cleared from the lumens. Flushing your CVC means putting a small amount of saline into each lumen to clear it out. Saline is a mixture of salt and water. Locking your CVC means putting a medicine called heparin into each lumen. Heparin prevents blood from clotting in the CVC and blocking the line when it is not in use. This process is also called a heparin lock. Please note, if you are allergic to heparin or have heparin-induced thrombocytopenia, HIT, tell your nurse. Your nurse will flush your CVC with a different medicine. Some CVCs only need to be flushed with saline and do not need a heparin lock. Your nurse will tell you if your CVC does not need a heparin lock. Your CVC lumen can get clogged or blocked with blood clots. Your nurse will try to unblock the lumen with a different medicine. If your CVC lumen cannot be unblocked, it will need to be removed and replaced. When to flush and lock your CVC. There are 2 main times when your CVC needs to be flushed with saline and locked with heparin. After IV therapy, usually a nurse will do this process, and if your CVC has not been used for 7 days. You must also change the end cap of your CVC lumen every 7 days. If your end caps become dirty, loose, or come off, you will need to change the cap and flush and lock the CVC on your own or with the help of your caregiver. How to flush and lock your CVC. There are 5 main steps you must take when you flush and lock your lumen. 1. Gather your supplies. 2. Prepare a clean work area. 3. Prepare the syringes. 4. Flush your lumen with saline. 5. Lock your lumen with heparin. Step 1. Gather your supplies. To flush and lock your CVC lumens, you will need disposable gloves, face mask, alcohol pads, saline syringes, 1 end cap for each lumen, heparin syringes. You will lock your CVC with heparin after the saline solution. Ask your healthcare team to find out where to get these supplies. You will need a prescription for the heparin syringes. Before you start, check the expiry date of the saline and heparin syringes. An expiry date is the date when a product is unsafe to use. Do not use a syringe that has passed its expiry date. The expiry date lists the year, month, and day. You can find this information on the syringe or plastic wrap packaging. Step 2. Prepare a clean work area. Before you open your supplies, find a clean, dry area. Do not flush and lock the lumens in a damp area like the bathroom, as this can cause an infection. Instead, choose somewhere dry like your living room or dining room. Clean your work surface with a disinfectant wipe or with soap and warm water. Remove all your jewelry from your fingers and wrists. Wash your hands with soap and warm water for 30 seconds. After you have washed your hands well, dry your hands with a clean paper towel. Put on a face mask and a clean pair of gloves. Then put your supplies on the clean surface. Step 3. Prepare the syringes. Before you flush and lock your CVC lumens, prepare all the syringes and end caps you will need for each lumen. For example, if you have 2 lumens, you will need the following for each lumen: 1 saline syringe for lumen 1, 1 saline syringe for lumen 2, 1 end cap for lumen 1, 1 end cap for lumen 2, 1 heparin syringe for lumen 1, 1 heparin syringe for lumen 2. Open the packaging of a new end cap, but do not take the end cap out. Leave the end cap in its open packaging for now. Hold the saline syringe with the syringe cap pointing up. Unscrew the white syringe cap and put it in the garbage. Do not touch the end of the syringe, as this can cause an infection. If anything touches the end of the syringe, clean it with an alcohol pad right away. With your other hand, pick up the new end cap that you recently opened. Do not touch the flat surface of the end cap. Push the saline syringe into the flat surface of the end cap. Screw the saline syringe clockwise and make sure it is secured. Push the saline plunger until you see a drip at the base of the white cap. Keep the new end cap and syringe connected and place it on your disinfected surface. Repeat the same steps for the other saline syringes. Now we will prepare the heparin syringes. You must prepare the heparin syringe to remove air. Pull the heparin syringe with the yellow protected cap pointing up. Unscrew and hold the yellow cap. Do not touch the end of the syringe and the opening side of the yellow cap, as this can cause an infection. If anything touches the end of the syringe, clean it with an alcohol pad right away. Remove air bubbles in the syringe by gently pushing the plunger. Push the plunger until a drop of heparin starts coming out of the tip of the syringe. Screw the cap back on the syringe, but do not over-tighten it. Place the syringe back on the disinfected surface. Repeat the same steps for the other heparin syringes. Your saline and heparin syringes are now ready to use. We are now on step 4, and we will be flushing your lumen with saline. Flush and lock each lumen before starting on the next lumen. Before you remove the old end cap, make sure the lumen is clamped. Make sure the clamp is placed on the thick, reinforced area of the lumen. Some CVCs will have this reinforced area, and some will not. Take an alcohol pad out of the packaging so it is ready to use in the next step. Hold the lumen with one hand and twist the old end cap to remove the cap from the lumen. Take the alcohol pad and rub the opening of the lumen back and forth for 15 seconds in a twisting motion. Stop rubbing and hold the lumen to let it dry for 5 seconds. Continue to hold the lumen and do not touch any part that has been cleaned. If you do, clean it again for 15 seconds with another alcohol pad. Pick up the new end cap that is connected to the saline syringe. Remove the plastic protector from the end cap. Remember to hold onto the end cap as you remove the protected cap. This makes sure the end cap stays in place in the saline syringe. Push the opening end of the cap into the lumen. Turn the end cap clockwise to lock it onto the lumen. Unclamp the lumen. Release the clamp on the lumen of your CVC. You will hear a clicking sound. Slowly start to flush the lumen by pushing the plunger in a pulsing motion. Push about 1 to 2 milliliters of saline at a time. Then pause, then push again. Do this until all the saline is used from the syringe. It is important to use this push-pause method to keep your lumen clear and open. While still keeping your thumb on the plunger end of the syringe, clamp the lumen back. You will hear a clicking sound. Remove the syringe. Hold the end cap of the CVC, not the lumen. Unscrew the saline syringe in a counterclockwise motion. you can throw away the syringe. The new end cap will stay attached to the lumen. The flushing step is now complete. Next, you will lock the lumen with heparin. We are now on step 5, the final step. Lock your lumen with heparin. Locking your CVC lumen is similar to flushing your lumen, only you will use heparin instead of saline. You do not need to change the end caps again when you lock your lumen. To lock your CVC lumen, clean the end cap of the lumen back and forth for 15 seconds in a twisting motion. Attach the heparin syringe to the end cap by screwing it in clockwise. Unclamp the lumen. You will hear a clicking sound. Push half a milliliter of heparin at a time in a pulsing motion until all 3 milliliters of heparin is given. Clamp the lumen while keeping your thumb on the plunger. You will hear a clicking sound. Unscrew and remove the heparin syringe from the end cap. Repeat the flushing and locking steps with the saline and heparin syringes on your other lumens if you have them. Once you have finished flushing and locking your CVC, place all used syringes and supplies in a regular garbage bin. Remember to always clean your work area before starting the flush and lock on your CVC. If you have any questions or concerns, contact your healthcare team. In this video, you have learned 1. What is flushing and locking your CVC? 2. When to flush and lock your CVC. 3. How to flush and lock your CVC.